Imagine waking up one morning feeling like your body has secretly turned into a high-speed engine that refuses to slow down. Your heart races even when you are just sitting quietly. Your hands tremble slightly when you hold a cup. You are sweating through your clothes in a cool room. You have lost weight without changing what you eat, and a strange, restless energy keeps you wired even though you feel exhausted deep inside. At first, you tell yourself it is just stress, maybe too much caffeine, or simply one of those phases. But week after week, the feelings intensify, and a quiet voice in the back of your mind starts whispering, "What if this is not normal? What if something inside me is seriously out of balance?" That something is very often an overactive thyroid, most commonly caused by a condition called Graves' disease. This butterfly-shaped gland at the base of your neck, no bigger than a walnut, controls so much more than people realize. How fast your heart beats, how quickly you burn calories, how warm you feel, how steady your mood stays, how strong your muscles remain, even how clearly your eyes focus. When it goes into overdrive and floods your bloodstream with too much thyroid hormone, every system in your body speeds up to a dangerous pace. Left unchecked, it can quietly damage your heart muscle, weaken your bones until they become fragile, inflame and bulge your eyes, disrupt your nervous system, and in rare but terrifying cases push you into a life-threatening crisis called thyroid storm. The truly frightening part: millions of people walk around with these symptoms for months, sometimes years, attributing them to anxiety, menopause, aging, or just being busy, never realizing their thyroid is the hidden culprit. The good news is that hyperthyroidism, including Graves' disease, is one of the most treatable endocrine disorders when caught early. Simple blood tests can confirm it, and today's treatments allow most people to return to feeling like themselves again, calm, steady, strong, and full of natural energy. In this ultra-detailed, doctor-explained guide, we are going to cover everything you need to know. We will start with a clear explanation of what hyperthyroidism and Graves' disease actually are, why they happen, and how they affect the entire body. Then we will walk through the 10 most important warning signs you should never brush off, diving deep into the science behind each one. What patients typically describe, why the symptom occurs physiologically, how severe it can become if ignored, and real-world clues that separate normal from "this needs attention now." After the signs, we will explore diagnosis, modern treatment options, lifestyle strategies that support recovery, long-term risks of leaving it untreated, answers to the most common questions people ask, and practical steps to take if you recognize yourself or someone you love in these descriptions. By the end, you will feel informed, empowered, and ready to listen to your body with confidence. Let us begin with the fundamentals. What exactly is hyperthyroidism, and why does it matter so much? The thyroid gland sits just below your Adam's apple, wrapping around the front of your windpipe like a protective shield. Despite its small size, it produces two main hormones, triiodothyronine, usually called T3, and thyroxine, T4, that act as the body's master speed dial. These hormones travel through the bloodstream and tell nearly every cell how quickly to burn fuel, produce energy, generate heat, and respond to signals from the brain and nervous system. Under normal conditions, the brain's pituitary gland releases thyroid-stimulating hormone to keep production perfectly balanced, enough to keep you warm, energetic, and metabolically healthy, but never so much that systems go into overdrive. In hyperthyroidism, that balance is lost. The thyroid pumps out far too much T3 and T4, and the body's metabolism accelerates to an unhealthy, unsustainable level. Every organ feels the strain. Heart beats faster and harder. Calories are burned at an accelerated rate. Nervous system becomes overstimulated. Muscles and bones break down faster than they rebuild. Temperature regulation goes haywire. Digestion speeds up. Eyes and other tissues can become inflamed in certain forms of the disease. The most common cause, accounting for 70 to 80% of cases, is Graves' disease, an autoimmune disorder. In Graves', the immune system mistakenly produces antibodies, called thyroid-stimulating immunoglobulins, that latch onto the thyroid and mimic thyroid-stimulating hormone, forcing the gland to produce hormone nonstop. These same antibodies can also attack tissues around the eyes, causing the characteristic bulging, and sometimes the skin on the shins, a rare thickened rash called pretibial myxedema. Graves' disease is far more common in women than men, Ratio roughly 7-1. Peaks between ages 20 and 50, runs in families, and is triggered or worsened by stress, smoking, infections, pregnancy, or other autoimmune conditions such as rheumatoid arthritis or type 1 diabetes. Now let us move to the 10 warning signs that appear most consistently and should prompt you to get tested. Sign 1. Unexplained and often rapid weight loss. You have not changed your eating habits. In fact, you may feel hungrier than usual and eat more, but the scale keeps dropping. 5, 10, 15, even 20 pounds vanish in a few months without effort. Clothes hang loosely. Friends comment that you look thinner or ask if you're on a diet. Why it happens? Excess thyroid hormone revs up basal metabolic rate so dramatically that your body burns calories even at rest, as if you were jogging lightly all day long. Muscle tissue and fat stores are broken down faster than normal to supply the energy demand. Red flags. Weight loss of 5% or more of body weight in 6 to 12 months without intentional calorie restriction, especially when accompanied by increased appetite. Sign 2. Rapid, pounding, or irregular heartbeat, palpitations. Your heart races even when you are lying in bed trying to sleep. You feel pounding in your chest, skipped beats, fluttering, or a sensation like your heart is jumping. Climbing stairs or standing up quickly leaves you breathless. Some people describe a constant awareness of their heartbeat that never quite settles. Why it happens? Thyroid hormones sensitize the heart to adrenaline and noradrenaline, increase the number of beta-adrenergic receptors, and directly speed up the sinoatrial node, the heart's natural pacemaker. Resting heart rate often climbs above 100 beats per minute, tachycardia. Danger. Prolonged overstimulation raises risk of atrial fibrillation, irregular, chaotic heartbeat that promotes blood clots and stroke, heart enlargement, and eventually heart failure if untreated. Sign 3. Anxiety, irritability, restlessness, and mood swings. You feel wired, jittery, unable to sit still. Small frustrations trigger big reactions, snapping at loved ones, feeling overwhelmed by ordinary tasks. Many people describe a constant inner trembling or restlessness that no amount of relaxation helps. Sleep becomes difficult because your mind races even when your body is tired. Why it happens? Excess thyroid hormone overstimulates the central and peripheral nervous systems, increases catecholamine sensitivity, and disrupts normal neurotransmitter balance, serotonin, dopamine, gamma-aminobutyric acid. Common misdiagnosis, generalized anxiety disorder, panic attacks, bipolar disorder, especially during manic phases. Sign 4. Heat intolerance and profuse sweating. You feel uncomfortably warm when everyone else is fine. Air conditioning feels essential even in mild weather. Night sweats soak the sheets. Excessive perspiration appears on your face, palms, underarms, and back without physical exertion. Why it happens? Accelerated metabolism generates extra internal heat. Blood vessels dilate to dissipate heat, and sweat glands work overtime. Sign 5. Fine tremors, especially in the hands. When you hold your arms straight out in front of you, your fingers shake with a fine, rapid tremor, 6 to 10 oscillations per second. Writing becomes shaky. Holding a cup or using tools feels unsteady. Why it happens? Overstimulation of the sympathetic nervous system and increased beta-adrenergic activity heighten muscle fiber excitability. Sign 6. Visible or palpable neck swelling, goiter. You notice a fullness or swelling at the base of your neck. Looking in the mirror, you see a bulge when you swallow. The area may feel tight, make swallowing solid foods slightly uncomfortable, or cause a chronic lump in the throat sensation. Why it happens? In Graves' disease, the thyroid enlarges diffusely, diffuse toxic goiter, because constant stimulation causes hyperplasia, increased cell number, and hypertrophy, increased cell size. Sign 7. Eye changes, Graves' ophthalmopathy/thyroid eye disease. This is one of the most specific and concerning features of Graves' disease. Eyes may appear prominent or bulging, ptosis, puffy or swollen eyelids, red or irritated, dry and gritty, sensitive to light, double vision when looking in certain directions, pressure or pain behind the eyes. In severe cases, vision blurs or narrows. Why it happens? Autoimmune antibodies attack connective tissue and muscles behind the eyes, causing inflammation, swelling, and forward displacement of the eyeball. Sign 8. Frequent bowel movements or loose stools. You go to the bathroom more often, sometimes 2 to 4 times more than usual. Stools may be looser or softer, occasionally bordering on diarrhea. Why it happens? Thyroid hormones accelerate gastrointestinal motility and increase secretion in the intestines. Sign 9. Menstrual irregularities, fertility challenges, or sexual dysfunction. Women may notice lighter, shorter, or missed periods. Some experience difficulty conceiving. Men may report reduced libido, erectile dysfunction, or reduced sperm quality. Why it happens? Excess thyroid hormone disrupts the hypothalamic pituitary gonadal axis, altering sex hormone binding globulin and sex steroid metabolism. Sign 10. Muscle weakness and profound fatigue. Despite feeling restless and wired, you struggle to climb stairs, lift groceries, or stand from a seated position without using your arms for support. Proximal muscles, shoulders, hips, thighs, weaken most noticeably. Paradoxically, you feel exhausted yet unable to relax. Why it happens? Thyroid hormones cause increased protein breakdown, catabolism, in muscle tissue and impair normal muscle energy metabolism. Serious complication, thyroid storm. A rare but life-threatening crisis triggered by infection, surgery, trauma, childbirth, or stopping antithyroid medication abruptly. Symptoms include extremely high fever, severe tachycardia, heart rate often over 140, confusion, agitation, delirium, nausea, vomiting, diarrhea, profuse sweating, heart failure or shock. This is a medical emergency requiring immediate hospital care. How doctors diagnose hyperthyroidism. Diagnosis begins with blood tests. Thyroid-stimulating hormone, usually very low or undetectable. Free T4 and free T3, elevated. Thyroid-stimulating immunoglobulin or thyrotrophin receptor antibodies, positive in Graves' disease. Additional tests may include radioactive iodine uptake scan, shows diffuse increased uptake in Graves'. Thyroid ultrasound, assesses gland size, nodules, blood flow. Eye examination or orbital imaging if eye symptoms are present. Treatment options, most people recover fully. Antithyroid medications, methimazole or propylthiouracil, block hormone production, often first-line treatment. Radioactive iodine therapy, destroys overactive thyroid cells, common definitive treatment. Surgery, thyroidectomy, removes most or all of the thyroid, used when other options are unsuitable. Beta blockers, propranolol, atenolol, quickly control heart rate, tremors, anxiety, and heat intolerance while other treatments take effect. Supportive therapies for eyes, lubricating drops, selenium supplements, steroids, radiation, or surgery in severe cases. With proper treatment, most patients achieve normal thyroid function, euthyroid state, and live healthy, active lives. Long-term risks if untreated. Osteoporosis and increased fracture risk. Atrial fibrillation and other arrhythmias. Congestive heart failure. Permanent eye damage or vision loss. Muscle wasting and chronic weakness. Thyroid storm. When to see a doctor, do not wait. Schedule an appointment promptly if you notice. Unexplained weight loss despite normal or increased appetite. Persistent racing or irregular heartbeat. Bulging or irritated eyes. Severe anxiety or mood changes with physical symptoms. Visible neck swelling. Tremors, heat intolerance, or excessive sweating that disrupt daily life. A simple blood test is all it takes to start the conversation. Your body is sending signals for a reason. Hyperthyroidism and Graves' disease are not rare, they are not mysterious, and they are very treatable. Listening early can prevent years of unnecessary suffering and protect your heart, bones, eyes, and peace of mind. If any of these signs feel familiar, reach out to a healthcare provider and ask for thyroid function tests. You deserve to feel steady, strong, and truly yourself again. You have got this. One step, one test, one day closer to balance.